Have you ever wondered what the symptoms of malaria are, and how is it diagnosed? Welcome back to the Victory Education Lounge. I'm Maurice, your guide on this educational venture. Today we're diving headfirst into Part 04 of our comprehensive series on malaria, specifically focusing on its symptoms and diagnosis. By now, those who have been following along with us understand the gravity of this disease, and for those just joining us, make sure to hit that like button, subscribe, and ring the notification bell to stay updated on all our future episodes. Don't forget to drop a comment below and share your insights or experiences with us. We value your participation in this learning community, so without further ado, let's jump into the symptoms of malaria. The symptoms of malaria can be quite deceptive, often resembling flu-like symptoms. This makes malaria a particularly tricky ailment to identify, especially in its early stages. However, understanding the symptoms is a crucial first step in recognizing and combating this disease. When a person is bitten by an infected mosquito, the symptoms of malaria typically emerge within 10 to 15 days. At the outset, these symptoms can be rather nondescript: a fever, chills, headache, muscle aches, and fatigue. Some individuals might also experience gastrointestinal disturbances such as nausea, vomiting, or diarrhea. But here's where malaria begins to show its true colors. One of its hallmark symptoms is a cyclical fever. This fever isn't constant, but rather it comes and goes, often accompanied by profuse sweating. The fever can spike, break, and then return again, typically every 2 to 3 days. This cyclical pattern is somewhat unique to malaria and can help differentiate it from other common illnesses. In severe cases, malaria can manifest more alarming symptoms. These may include jaundice, which results in yellowing of the skin and eyes, confusion, and seizures. If left untreated, malaria can even lead to death, underscoring the importance of early detection and prompt treatment. While the symptoms we've discussed are common, it's important to remember that they can vary in intensity and duration from person to person. This is due to factors such as the type of malaria parasite causing the infection, the individual's overall health, and their immunity level. The deceptive nature of malaria symptoms highlights why it is often misdiagnosed, especially in regions where it's not common. People might dismiss the symptoms as a common flu or another minor ailment, which can delay the necessary treatment. Recognizing these symptoms is crucial, but diagnosing malaria requires a more clinical approach. In our next segment, we'll delve into the diagnostic methods used to confirm a malaria infection. Stay tuned to learn more about the fascinating, albeit dangerous world of malaria. Diagnosing malaria is a critical step, and it often requires a blood test. Let's get into the nitty-gritty of how malaria is diagnosed. The process may seem daunting, but it's relatively straightforward. When you visit a healthcare professional with symptoms that suggest malaria, the first step is often a blood test. This isn't just any blood test, it's what we call a blood smear test. Here's the deal with this test. A sample of your blood is smeared onto a glass slide, stained to highlight the parasites, and then examined under a microscope. This allows the healthcare provider to visually confirm the presence of malaria parasites in your blood. But what if you're in a remote area, far away from a laboratory or a hospital? That's where Rapid Diagnostic Tests, or RDTs, come into play. These tests are faster, simpler, and don't require a lab. The test involves placing a drop of your blood on a test device and waiting for results, much like a pregnancy test. If the test is positive, it shows a distinctive color or symbol. Now you might be thinking, great, let's just use RDTs all the time then. Well, hold your horses. While RDTs are invaluable in certain situations, they're not perfect. They may not always be as accurate as a blood smear test. For instance, RDTs may not detect low levels of parasites in the blood, and they may not differentiate between different species of malaria parasites. So there you have it. A blood smear test is the gold standard for diagnosing malaria, but RDTs can be a useful alternative in certain situations. Remember, these tests are tools that healthcare providers use. What's most important is that if you suspect you've been exposed to malaria or are experiencing symptoms, you don't delay. If you suspect you've been exposed to malaria or are experiencing symptoms, it's essential to seek medical attention immediately. The good news is malaria is treatable with prescription medication. The specifics of this treatment depend largely on the type of malaria parasite causing the infection and the severity of the symptoms. A common form of treatment is Artemisinin-based Combination Therapy, often referred to as ACT. This is a powerful 1-2 punch of antimalarial drugs and is considered the most effective treatment for Plasmodium falciparum, the deadliest strain of malaria. But what about less severe strains of malaria? Well, there's chloroquine. This medication has been a cornerstone of malaria treatment for decades, and it's especially useful in combating strains that are less severe than Plasmodium falciparum. Now let's talk about the pros and cons of these treatments. On the upside, these treatments are generally effective. For most people, symptoms start to clear up within a few days of starting medication. It's like a breath of fresh air after being bogged down by the heavy, flu-like symptoms that malaria often brings. But like any medication, antimalarial drugs can have side effects. Some people might experience nausea or dizziness. In rare cases, there might be more severe allergic reactions. It's always important to discuss these potential side effects with your healthcare provider before starting treatment. We also need to mention drug resistance. This is when malaria parasites evolve and adapt to survive in the presence of the drugs meant to kill them. It's been becoming an increasing issue in some parts of the world. That's why ongoing research and development of new antimalarial drugs is crucial. So there you have it. Malaria might be a dangerous disease, but it's also a treatable one. With the right medication and medical care, people with malaria can make a full recovery. But let's not forget the old adage, prevention is always better than cure. Next, we'll discuss the various strategies for preventing and managing malaria, because the best way to beat this disease is to avoid catching it in the first place. Preventing malaria is crucial, especially in areas where the disease is common. Let's delve into different strategies that can help you stay one step ahead of this disease. First off, we have mosquito nets. These aren't just any nets. They're treated with insecticides to deter those pesky mosquitoes. Imagine a shield, an invisible barrier protecting you while you enjoy a peaceful night's sleep. Sounds like a dream, doesn't it? Well, this is exactly what mosquito nets offer. Their affordability and effectiveness make them a popular choice. However, they're not invincible. Over time, they can get damaged, and unfortunately, some mosquitoes can develop resistance to the insecticide. Next up, we have insect repellents and sprays. Imagine if you could wear your protection. Insect repellents allow you to do just that. By applying these products to your skin, clothing, or other surfaces, you create a repelling barrier against mosquitoes. And for those of you who are thinking, what about the smell? Fear not. Many of these products are pleasantly scented. But remember, not all that glitters is gold. While these repellents are generally safe, some people might experience skin reactions, so it's always a good idea to test a small amount first. In addition to these personal preventive measures, community-wide strategies such as indoor residual spraying and larval control play a significant role in reducing the overall mosquito population. But let's remember, prevention doesn't end with these strategies. Regular medical checkups, especially in endemic areas, are key to early detection and treatment. This not only protects you, but also prevents the further spread of the disease. So whether it's donning that insect repellent, sleeping under a mosquito net, or participating in community-wide initiatives, every step counts in the battle against malaria. And let's not forget the importance of staying informed and sharing this knowledge with others. Remember, the best way to fight malaria is to prevent it in the first place. So there you have it, the symptoms, diagnosis, treatment, and prevention of malaria. We've journeyed through the initial signs, which can often mimic the flu, to the more severe symptoms of cyclical fever, jaundice, and even seizures. We've discussed the vital role of blood tests in diagnosing this disease and the use of rapid diagnostic tests in remote areas. We've also touched upon treatment options including Artemisinin-based Combination Therapy and chloroquine. And finally, we've highlighted the importance of prevention with simple measures such as mosquito nets and insect repellents playing a critical role. Remember, knowledge is power, and the more we understand about malaria, the better equipped we are to fight it. If this information has been helpful to you, consider sharing it with others. It might just save a life. And if you have any personal experiences or thoughts, we'd love to hear them in the comments below. Stay healthy, stay informed. Until next time, see you in the next episode of Victory Education Lounge.